Scott, let's get to what you wrote about in the Wall Street Journal today, and that's just the idea that there's not going to be enough of these drugs or these antiviral cocktails or any of the things that you could use to try and ease COVID when it hits. How do we figure out who gets what? I mean, it seems like if you have money, if you have an in, maybe you're at the top of the list. Is that how it's going to work?
I hope not. I think the challenge with these antibody drugs can be a bridge to a vaccine. We've been saying this since April and May. We're not going to have enough supply, unfortunately, because we didn't make the right decisions back then to ramp up production. We'll have a lot of supply heading into 2021. The companies have done really good work trying to ramp up their own production, but we haven't had a deliberate strategy. I think the bigger challenge right now, and this is what I wrote about in the Wall Street Journal today, is for these antibody drugs, you really have to give them when someone's first diagnosed, before they're very sick, ideally before they're even symptomatic. So they're going to be authorized for vulnerable patients, older patients initially, because we don't have enough drugs, so we're going to have to ration them. And you're going to have to ask someone who's not very sick to go into an emergency room to get an infusion, because that's the government plan. The government plan is to distribute these inside emergency rooms. And if someone's having coronavirus and they have to go to the emergency room to get an infusion, chances are they're in a location where there's an epidemic. So those emergency rooms are going to be overrun. So now you're asking someone who's not very sick to go into an emergency room to get a 3-hour infusion, knowing that there is an epidemic and there's probably going to be a long wait inside the ER for that drug. And mind you, patients are reluctant to take injectable drugs to begin with. People are comfortable swallowing a pill, but they always perceive taking an infusion as something that's riskier. So I think there's going to be a lot of reluctance to use these drugs given the way the government plans to distribute them. And what we're advocating is that they should be distributed at home. We should use home infusion to be administering these drugs. The other challenge with bringing people into the emergency room is that you're bringing them into the emergency room. So they're bringing COVID patients to the emergency room. You're asking someone to take them to the hospital. So you're going to expose a lot of people in the process versus sending a trained nurse into someone's home to give them a home infusion, and that nurse can protect themselves with an N95 mask. So I think we need to rethink the distribution strategy if we're going to want to make use of these drugs this fall.
Shepard Smith here. Thanks for watching CNBC on YouTube.